Hi, I'm Erin with Best Life Physical Therapy, and today we're going to talk about somatic tracking. This is one of the very important techniques that I'd like you to kind of become familiar with. And we're going to use this technique as a way to allow your body to feel these sensations that are being created from your brain and to try to perceive them with safety. So before we try this technique, we want to make sure that your pain is not at a level that is too high. So if you're at a level where your pain is high right now, I would not recommend that we do somatic tracking today. If that is where you are, then we're going to use some of our avoidance techniques. And so what those are some of the exercises that I've given you, some of the calming techniques that we've done together to allow your nervous system to feel safe again so that you're not in a great amount of pain. It might be one of the stretches or the techniques that we've done together. Do those today. However, if your pain is at a manageable level, maybe a 3 or a 2 or somewhere lower on the pain scale, this is a great time, maybe a 4 even, that would be a great time to go ahead and try the somatic tracking technique. And in that regard, we're gonna use your pain as an opportunity to make a positive experience out of this or a constructive experience out of it. So what we're gonna do is we have to view these opportunities when we're having a little bit of pain, but not a lot of pain, to do this technique called somatic tracking. And this falls into the category of surrendering and not trying to fix it, not trying to be a change at all, just kind of accept what it is. So the goal of this technique is not to feel less pain. The goal is just to feel safe and to acknowledge that these are sensations. We can name the sensations, and giving them a name can actually be very impactful and beneficial to the brain. And then you can just watch and listen and see what happens to those sensations. They may move, it may go from one place to another. So what you're gonna do is go ahead and let's take a couple of deep breaths to begin. So it's gonna be an inhale through the nose, deep and low, exhale nice and slowly. We want to have that longer exhale in order to allow the nervous system to calm down, get into parasympathetic a little bit. So inhale, deep and low, and exhale even more slowly than the inhale. And then I would like for you to just I'm asking you to focus on the pain for just a moment. So send your attention to that area of the body where you feel pain and just see what it says and give it a name. Use adjective to describe what is going on there. But what we're trying to do here is to just sense the sensation without fear. Because the pain is not so high right now, you can just note what is happening. Okay, I feel the tightness in that area. And then just notice what happens. Does it change? Is it staying the same? Is it moving to a different part? Can you give it a different adjective now? And just notice and just remember, we've already accepted that the brain is creating these sensations, and that it's just an alarm system that is kind of a faulty. It's misinterpreting these signals and giving us pain even though they're safe sensations. So we're giving messages of safety to these low levels of pain that we're having, and just pay attention and just see what happens to the symptoms. Sometimes the pain will go away. It will lessen. It will get worse. Sometimes it changes and gets to be more like of a stabbing pain, and then it goes into a dull pain. But all of this is, we're just accepting what is happening and taking this as an opportunity to give a connection to our brain where the nerves that wire together fire together, that we are safe and we are not in danger. So sometimes this technique really works to decrease pain, but remember, that is not our goal. We are not trying to decrease pain, although sometimes it does happen. And it's just giving us an opportunity It's just like exposure therapy. We're exposing the brain to the pain and introducing the concept of safety with that experience, so that there's no reason for the body to combine the sensation with the feeling of danger any longer. So this is how somatic tracking works.